Hi, I'm Kristen Ritchie, Certified Foot Care Nurse, and today we're going to go over professional foot and nail care and why you may want to see a specialist. It is available to anyone, and it's helpful for people with physical limitations. And going to a professional reduces your risk of injury and infection. First, it gets you on a regular schedule, and secondly, it is given by a trained professional, so there's less risk of getting injured. It is provided by podiatrists who may also help with more complex issues, such as if you have an infection or if you need more care for an ingrown nail. And it's also provided by certified foot care nurses who can come to your home if you're unable to see a podiatrist for routine foot care. So the topics we will discuss are conditions that increase the risk of injury, types of injuries, and injury prevention. So there are age-related changes that cause barriers to safe foot and nail care, and a big one is loss of gripping strength, and that can be from osteoarthritis or a variety of things, where you're not able to clip as well as you used to, and that could also be due to if you have thicker nails. The other one is decreased range of motion, and that can be from pain if you have a chronic injury, or also from osteoarthritis. There's also a possible decreased level of flexibility, so trying to get to your foot, as well as even bending over if you have problems with hypotension or orthostatic hypotension. You could end up getting dizzy and falling. And there's also if you've gained weight from fluids or fat and just can't reach your feet. Also, if you have sight-related changes from aging or otherwise, if you can't see as close as you used to, or if cataracts or macular degeneration is blocking your sight, we're going to review why that's not good to continue to do your own foot care. And there's also travel limitations, and this is good for if you want to see a certified foot care nurse, they can come to you. Traveling can be expensive. If you need to have your feet routinely cared for, you might have a loss of social support, you don't have someone who can drive you, and loss of income. Transportation can be expensive. So we're going to do an activity identifying our limitations. So if you normally cut your nails, if you can, take off your shoe, role play cutting your toenails. Pause this, and when you're done, we're going to move on to some questions. Okay, so after doing that, or remembering the last time that you did that, if you didn't feel like taking off your shoe, some things to think about. Did you use your sensation of touch more than sight? If you're trying to feel where to cut your nails, that could be dangerous because you could end up cutting too close and cutting yourself. Did you have difficulty reaching your toes or gripping the clippers? And that's going to be, of course, frustrating. And so someone who's trained in foot care can help you with that to reduce their frustration. So a couple things that we want to talk a little bit more about. There's also possible loss of protective sensation in some people. So you may be relying on your sense of touch, trying to feel where to cut the nails, but you lost the sensation in your toes. And so you also can't tell how well you're cutting your nails. And loss of protective sensation, that's actually really serious because you could end up getting an injury and not knowing it. So if you have that, and that can be tested if you see a certified foot care nurse, they can test your protective sensation with a monofilament test. But it would be important to go to a podiatrist so the podiatrist can figure out, do you need protective orthotics? Do you have hammer toes or mallet toes, or are you pronating, or do you have bunions that could end up rubbing? And we're going to go over that a little bit more. Do you need special shoes with the extra depth? And they could perform procedures for these foot deformities to reduce risk of friction injuries, which we'll go over, and also pressure injuries. And so also by that activity, we want to accept our limitations and say it's okay. Going to a routine foot care specialist is similar to going to the dentist. We need help cleaning our teeth. We need help with our foot and nail care. So let's go over some types of injuries. There's sharp force trauma. So this is where you could be cutting yourself with something sharp. So for instance, cutting your skin or your nail bed while you're clipping your nails. Now the hyponychium, that's the area that's right under the free edge of your nail and is most likely going to be the thing that's cut when you're cutting your nails. There's also the perinychium. That's the skin along the side of your nail that's keeping the nail bed and the nail together. And then there's the eponychium, which can often get cut if you or someone else is trying to cut your cuticles. Other kind of short force trauma, it can be from your own nail. And so ingrown toenails, that's referred to as onychocryptosis. And that can come from a nail getting overgrown, which is onychogryphosis. Not that you need these terms, but I think that they're interesting. And so the overgrown nail, it can actually grow out and around and down and pierce the bottom of your toe or your loved one's toe. So it's really important that you don't let the nails go for a year or longer without cutting. There's also devil horns that can come about from an improperly cut nail. There's two ways that you can get devil horns. One is if you're cutting it but you don't cut all the way to the edge of the free edge, and that leaves a little spike. The second one is if your nails have gotten long, they tend to curl under. So if you cut straight across, and sometimes even if you cut along the free edge, when the nail releases, because there's not that pressure curling it, there's more pressure from the nail bed pushing up, so it kind of uncurls it, devil horns can appear. So that requires a professional to know exactly how to cut to avoid those devil horns. You might also have pincer nails. There's the force of your nail bed pushing up from walking and whatnot. And then there's the force of the nail itself. So nails want to curl and nail beds want to push up. So there's a balance. But when you have pincer nails, the balance is lost. And so the thicker your nails get, the more that they can curl, because the nail force, the curling force, it's not a technical term, but that causes the pincer nail. And so pincer nails, then they can cut into your toe. So that's why it's important for a professional to thin your nails so that they don't curl into pincer nails and cut you. Also, tight shoes can influence the direction of the growth of your nail to end up cutting into your toe. And also other toenails can cut into your adjacent toes. And then there's overpronation, which is when you're walking, if you are walking more on the inside and pushing off on the inside of your foot, of your toes, that's also pushing the nail up into your toe. So overpronation, that can be adjusted with orthotics from a podiatrist. Another kind of injury is blunt force trauma. So this is if you're walking and stub your toe on something, if you drop something on your foot, or if someone steps on your foot. That can end up causing some foot problems. And then you have pressure, shear, and friction injuries. Pressure is if you're pushing down. Shear is if you're pushing down and over. And both of those will restrict, reduce blood flow to tissue, which could cause tissue death. And then friction injuries, which is rubbing. So the pressure and shear injuries, they're known as bottom-up injuries because the deeper tissue is affected first, and then problems arise from that. And so that's what are referred to as pressure ulcers. And so it's caused by pressure points. These pressure points can come about by thick nails. If your thick nails are pushing up on your shoes or your socks. So we've gone over overgrown nails, but there's also thick nails. It's onychosis, thick nails that happen from trauma. So if you have that blunt force trauma, blunt force injury, you drop something heavy on your toe, that nail may have a tendency to become thick, which would then require thinning. And then onychomycosis, or the fungal nail infection, is thick from the infection. And then you also have pressure points that could come from thicker skin. So hyperkeratosis, which is calluses and corns. But there's also thickening of the skin in the nail bed. So if you have the rubbing of thick nails on your shoes, that can cause basically a callus to your nail bed, and it would make it end up looking like a thick nail, which you may have thick nails, but the thick nail bed can't thin that. So you would need to address that with deep shoes. And then there's the foot and toe deformities that we talked about. Hammer toes and mallet toes and claw toes, basically toes that curl over, and the knuckles of your toes are going to be rubbing up against your shoe, and also the front of your toe, that in claw toes and hammer toes, possibly mallet toes too. It's going to have constant contact with the ground. So the top of your toe is having contact with the ground. That nail is going to have constant contact with the ground, and it's going to have constant pressure, and that's going to have some issues too. There's also bunions and bunionettes. Bunionettes are just on the other side of your foot. So the bunions, that's when the greater toe goes towards your pinky toe, and the bone, the metatarsal head, goes the opposite direction. Those are pressure points that can end up causing pressure injuries. And then we have foreign objects in your shoe. This is why it's important to check your shoes if you have a rock or a pebble or anything that just happened to go in there. So objects in your shoes and tight shoes, which we talked about throughout these other thick nails, thick skin, and foot and toe deformities. Tight shoes are the contact point of those pressure points. And then you have the friction injuries, which is more top down, wearing away the layers of the skin, referred to as denuded skin. But you could also have blisters. You have a new pair of shoes and you develop blisters. That's because you have damage to the epidermal layer of the skin, not the dermal layer, and it builds up fluid trying to protect itself. So the resulting infections, just a broad idea of them, there's onychomycosis, or the fungal nail infection. If there's any passageway that yeast, mold, and fungus can get to your nail, it can get under the nail plate and be very hard to get rid of. Then you may also be at risk for non-healing wounds. If you have low circulation, you don't have the nutrients and the blood flow that you need to heal those wounds. So it can be caused by poor circulation. You may not have the nutrients. Even if you did have good circulation, you may have other conditions that are taking up all those nutrients. And non-healing wounds are at a great risk of infection, and it could turn into a bone infection or osteomyelitis. At that point, once the infection is in the bone, it's a pretty simple solution, is amputation of that, not the full digit, but just of that small bone that is infected, and then that gets closed off, and that's a safe way to take care of it. So here's our activity for types of injuries. It requires a piece of paper and a pencil and a bare foot. If you can find an 8x10 piece of paper and a pencil or a pen or marker or crayon, highlighter, I want you to trace your foot, and you can pause this and go ahead and do that. Now that you've done that, I want to go to your closet, if you're around, or the shoe that you're wearing now. Take your shoe and put it on top of the tracing of your foot that you just made. So if you look at the tracing, can you see any lines? Does your shoe completely cover it, or are there some lines sticking out? And you may see some lines sticking out if you're wearing pointed toe shoes, but if you have boxy shoes and of the right length and such, hopefully you don't see any lines. If you do see lines, your shoes are not fitted for the shape of your foot, and a professional shoe fitter can help you find a fit that will reduce the risk of pressure and shear injuries. And it's important that you wear shoes, because shoes are going to protect you from blunt trauma, and we're going to look into that in a little bit in the preventing injuries. A couple questions to think about. What happens to your skin in a poorly fitted shoe? We know that if you have friction, what could end up happening is your skin builds up a protective layer and it gets thick, and then in turn the thickening of the skin can cause a pressure point. The other thing that could happen is it could wear away your skin and cause an erosion and an injury that way. The other question, what happens to your toenails in a poorly fitted shoe? We know that shoes can influence what direction the toenail grows, so it can cut into you. We know that if there's pressure on the toenail, that could release it from the nail bed, and then mold, fungus, and yeast could end up getting in there and causing a fungal infection. So the things that we want to think about in this activity that we did is that we want to reduce friction by having properly fitted shoes. Same with pressure and shear. We want to keep our nails to the proper length and the proper height so that they're not putting pressure. Same with corns and calluses, and if you have any foot deformities, you need a deeper depth shoe. So we want to avoid getting wounds because they could end up being poor healing or non-healing and lead to infection. Injury prevention. So first we talked about sharp force trauma. Things that we can do to reduce sharp force trauma is think about, where are we getting our nail care? Are we doing it ourselves? Are we able to still do it ourselves? Or are we at risk of cutting ourselves or clipping ourselves? An untrained person, you may think that it's just cutting nails. I cut my nails all the time. For my whole life, they cut their nails. But you do have to be trained to cut someone else's nails because it's serious if you end up cutting them. It can be serious. So you really need to see a professional who has the knowledge and who has the skills. And for nurses, you need to look for that certification to make sure that they have the knowledge and the skills. So we want to reduce the risk of cutting your skin or cutting your nail bed and of creating devil horns. So that's sharp force trauma through foot and nail care. Sharp force trauma through ingrown toenails. We can avoid getting ingrown toenails by making sure we have routine foot care so that they don't get too long and they don't get too thick. We want properly fitted shoes so that the shoes aren't having our nails grow into our toes or into our adjacent toes. And we want orthotics to help those gait abnormalities such as overpronation, which you can get from your podiatrist, and those should be checked annually because our gait changes, the way we walk changes. So orthotics are going to have to change with that. How can we prevent blunt force trauma? Protective shoes. You have to have those closed-toed shoes to provide protection to the top of your foot from someone stepping on it or from dropping something on it. And rigid soles for protection of the front, so you're not stubbing your toe, and protection from the bottom, which is a sharp force trauma protection. But if you also think about it, that sole of your shoe is acting like the nail of your toe. It's going to stop whatever your foot has in contact with before it hits something soft and injury prone, such as the skin part of your toe. So rigid soles are good protective features of footwear. How can we prevent pressure and friction injuries? Shear as well. Have those shoes be properly fitted by a professional. Make sure that the length, width, and depth are all what your foot needs. They have those metal measuring things, I forget what they're called, to make sure that you get the best shoe. The custom-made orthotics you can get from your podiatrist, and always check for foreign objects in your shoe before you put your foot in there. I mean, there could also be a spider in your shoe, so it's always good to check your shoe before you put your foot in there. And then the regular foot and nail care prevents the pressure and friction injuries because you're reducing the amount of pressure points that your foot has built up. In this activity, we're going to take a look at our fingernails, because fingernails are a lot like toenails, or toenails are a lot like fingernails. And so if you have reading glasses or magnifying glass, or if you actually have good eyes, check out your fingernails. And so first we're going to be looking at what's called the onychodermal band, and it's a translucent band that separates the nail bed from the free edge. And so this runs along the hyponychium. It's a curved line. It runs along the free edge, and that is sort of the sealing line, the seal, S-E-A-L, seal line of your nail plate to the nail bed. And a lot of people might call it the quick. You don't want to cut this because it's going to bleed and it's going to hurt, and it becomes an entry point for ending up getting a fungal nail infection or just an infection in general. Okay, second, I want you to look at the sides of your nails. So this is what we were calling the perinychium, and it's where you might get a hangnail, or if it's an infection, it's called perinychia. So you can see there's very little free edge, and the nail plate and the nail bed are pretty closely sealed. So you don't want to cut too much of the side of your nail in normal circumstances. Overcutting can lead to an ingrown toenail if you leave a little piece, so those devil horns. So if you're cutting the perinychium, or if you're creating a situation of devil horns, that increases the risk of infection. We don't want to cut too much of the sides of our nails. And then let's look at our cuticles. So this is what we're looking for, is protection of the eponychium. And so the cuticles, that's the accumulation of dead cells, and it might advance, and that's why people think they need to push back their cuticles. And some people do that for their toes, especially if they're getting a pedicure. But you don't want to do too much of this, because the eponychium creates a seal to the nail plate, and it protects the nail matrix. The matrix is where the nail plate is produced. It's like the root of a hair. A hair root to a hair is like your matrix to your nail plate. So we want to protect that matrix. We don't want a fungus, yeast, mold getting in there, because that's very difficult to get rid of. So we don't want to excessively push back our cuticles or have someone else do that. We want to be conservative if we're reducing our cuticles, because they might advance and you might have a buildup of dead skin cells from your eponychium, but you need to be careful how you remove that. So our questions, and these are just more of reflection questions. So if someone is clipping your nails, do you want him or her to go as short as possible so you don't have to get your nails clipped again for a while? Or do you want him or her to clip conservatively and thereby protecting the integrity of your skin? And that's kind of a loaded question. Of course, you don't want to get cut. It's just not worth the risk cutting too short, because you want to reduce the amount of visits that you have from a foot care professional. You want to maintain the integrity of your skin. And the other question, what are other ways you can protect your skin in nail bed? So if we think about this, so we know that we don't want to cut too short, and we know that we want to think about the different areas of the nail. So for the hyponychium, the front, around the free edge, we don't want to cut too short. Around the sides, we don't want to separate that nail plate. We don't want to cut too much on the sides. For the cuticle, we don't want to push it back too far. We don't want to cut it and end up cutting the eponychium. So those are some sharp injuries that we want to avoid. So these questions based on our activity are more sharp force injury based questions, but let's think about blunt force injury questions. How can we prevent a blunt force injury? Wear protective shoes that fit and have rigid soles and have closed toes. So protective shoes. For preventing friction injuries, we want to make sure that we don't have any pressure points, whether it comes from your foot or something from inside your shoe or from a poorly fitting shoe. So we want to reduce those pressure points. We want to protect our foot from blunt trauma, and we want to be careful how we cut our nails so that we can prevent sharp force trauma, and do routine foot care so that our nails aren't cutting into our toes. So your skin, intact skin, is the best line of defense from infection. Those dead skin layers, not to the point of thick calluses and corns, but at a certain point, it protects the top layer of your skin from friction. So we talked about how friction can remove layers of skin. So those dead skin cells are providing layers of skin for protection from friction. We don't want to take down our skin all the way down, because we still need some of those dead skin cells to protect our skin. So yes, we want to remove any kind of pressure points, but still we want to be conservative about how much dead skin we take off. Foot hygiene is important. Removing too much puts you at risk. Moderation is the key. So things we want to remember: don't cut too short, don't remove too much, even though it's more convenient so that you don't have to see a professional as often. It's important that you protect the integrity of your skin and of your nails, and keep mold, yeast, fungus, bacteria out of your system and away from possible infection. So let's review the topics that we went over. We talked about conditions that can increase your risk of injury. If you can't see, if your eyes have gotten older, if you have cataracts or macular degeneration, if you can't reach because of range of motion, and if you can't grip from pain of osteoarthritis or weakness. We went over the types of injuries. Sharp injury is pretty common if you're trying to cut your own nails, or if you have someone who is not skilled cutting your nails, or if they are skilled and they're just cutting them too short. We want to be conservative how we cut and how we thin. We went over blunt force trauma, where you really need to wear those protective shoes. And then we have the pressure or shear injuries, where it's putting pressure down, cutting off the blood flow to deeper tissues and causing what we call pressure ulcers. and then the friction injuries of it just wearing away that top layer of skin, causing an open wound that way. And we want to prevent all these different types of injuries. So when you're thinking about injury prevention, think about what you want to prevent and what you want to protect. And we want to protect all around the sides of our nail. We want to protect those parts of our feet that are sticking out too far, from mallet toes or hammer toes, and rubbing on the tops of our shoes. You can see if you have red marks on your toes, that's an indication that there's friction and there's pressure and your shoes aren't fitting. So you can see a podiatrist to address those issues, or get a shoe with more depth, or get some protective padding. Having those properly fitted shoes, the regular foot and nail care by a professional, and seeing your podiatrist for those complicated issues. This is a participant evaluation, and it's just a little 4-question multiple choice quiz that you can take if clicking the links, which are either the one participant evaluation or the word here. And if you can take a couple minutes, click on that and take the test. It's going to take you to a Google document, and when you're done with that, click submit and come back, please. Thank you. Okay, so to review what you chose, question number 1. If I can't see my toes, I should. Now let's go through the answers. A, clip them by feel and memory. And so we know that that can cause problems. 1, you might not be able to see that onychodermal band for where your hyponychium is, and you could cut yourself. And 2, if you're starting to lose the sensation of your toes, you're not going to know exactly where that clipper is, and you could end up cutting yourself. So we don't want to go with A. B, have an untrained person clip them. And so we know untrained people may end up causing devil horns. They may end up cutting too close. These things causing the sharp force trauma can cause those wounds. Your feet, we know that feet don't get the best circulation. They're really far away from the heart. And so that decrease in circulation, possible decrease in nutrients, you could end up having a wound that is slow to heal, or possibly even a non-healing wound if it ends up getting infected. Once a wound is infected, it's even more difficult to heal. So it's not B. All right, let's look at C. Have a foot care professional clip them. That sounds pretty good. And let's just look at D. Leave them alone until there's a problem. We know we don't want to leave them alone. If we don't cut our nails, they'll get too long, they'll get too thick, possibly, and we'll start having problems with our shoes pushing onto them, the nails cutting adjacent toes, or the nails ending up cutting the same toe if it grows all the way over, like in onychographosis. So we don't want D. So yes, a good, safe option is have a foot and nail care professional clip them. Number 2, I can tell if my shoes are too small because A, I made a foot tracing and my shoe covers the whole print. Well, that's great. It means that your foot should fit completely inside your shoe, so your shoe would not be too small. So that's good. So it's not that. B, I have red marks on the tops of my toes when I take my shoes off. Red marks on the top of your toes aren't good. So let's look at the other ones. C, my heel slips up in the back of my shoe when I'm walking. That might indicate that your shoe could be too big, or sometimes shoes just slip up. But if you talk to a professional shoe fitter, they can address those issues. So it's not C. And D, my toes have enough room that I can move them around. That's great. You want to be able to wiggle your toes, so it's not D. So we know our shoes are too small if you have red marks on the tops of your toes, because that indicates you have some pressure, you have some friction, and those could turn into wounds. So we want to get better fitting shoes with a deeper toe box, and possibly go to your podiatrist to see if he or she can address any toe deformities or foot deformities. Number 3, injury prevention is important because an injury could A, cause an infected wound. Yes. B, cause a fungal infection of the nail. It could. C, lead to a non-healing wound. in unfortunate circumstances, it could. D, all of the above. So A, B, and C, that's all possible given certain circumstances, and we just don't want to take that risk. So we say D, it is all of the above. And number 4, I know that an injury and possible infection can be prevented by A, wearing my favorite open-toed sandals. Well, we don't want to do that because you could drop something on your foot, and even though it has the rigid sole that might keep you from stubbing your toe, hopefully it's not going to protect someone from stepping on your foot or dropping an object on your foot, which could cause a wound in itself, or it could cause your nail plate to react to that trauma by getting thicker. So not A. B, hiring an uncertified nurse to provide nail care. So uncertified means that this nurse, we don't know if he or she is trained. We don't know if he or she has the education. And so that's not a safe choice. If a nurse wants to do foot care, they're required by the state to have knowledge and to have training. So that certification helps you know that they did get that. So it's not that. So C, we can prevent injury and possible infection by building up extra calluses even though they may hurt. No, because we definitely don't want anything that hurts. If it hurts, we want to go to a podiatrist and get that attended to. Or maybe your certified foot care nurse might have an idea about how to prevent any pain. But those extra calluses, we know, are going to cause pressure points, and that could lead to pressure ulcers, and even on the bottom of your foot, on the metatarsals. So we don't want to build up any extra calluses. Some calluses are protective, extra calluses are pressure points. So we want to go with D, seeking foot and nail care from a trained professional, and that can ensure that you know that they have the knowledge, that they have the skills, and that there's going to be a reduced risk for any injuries that might lead to infection. So that is the end of this presentation, and if you please, would you click on either course evaluation or the word here and fill out a course evaluation. It's just the 3 questions. If you can't think of 3 things for each question, that's fine. Just any information will be helpful for me to improve this course. So the first one is list 3 concepts that may apply to you now or in the future. You can think about the first activity that we did, role-playing cutting our nails. Was it difficult to see? Was it getting more difficult to see, to reach, or to apply that pressure to clip your nails? Which one might apply to you either now, or what do you think might be a problem in the future? And keep that in mind and be okay with it if it's a problem and you need to see a foot care professional, because your feet are important. Number 2, list 3 things that you felt were helpful in this presentation. Anything that you may have learned or not really thought about, or could have helped reduce your risk of injuries, which could lead to infection. And number 3, list 3 things that you did not like about this presentation. I know that I rambled on a bit, so you can say if it was long-winded. That's fine. But if something just doesn't apply to you, or you thought something was too obvious, or if the learning activity just didn't work for you. So anything that you can mention that is significant, not just putting it down for the sake of putting it down, but I really want to improve this course, and this will really help. So thank you. Thank you for going through this. Thank you for listening to me. And thank you for working through the activities and the questions. And I hope that it gave you something to think about for either now or in the future, or for even someone you know, that prevention is key, and it's important to be protective of your feet. It's important that if you can't provide safe foot care for yourself, you go to someone who can provide safe foot care. Thank you so much for watching, and have a great day.